Dr. Osama Hamdy. I'm the medical director of the obesity clinical program at Joslin Diabetes Center and clinical investigator in the section of clinical research and associate professor of medicine at Harvard Medical School.
In your clinical practice, which activities have the best results in engaging patients to make changes to help control their glycemic levels?
In my clinical practice, I found that there are three activities that I do that get me the best results for all my patients. The first one, I educate them very well about their disease. So they understand exactly what their disease is, what exactly the reason why they get diabetes, what their type of diabetes, how we can manage. I engage them with me in making the decision about how we can deal with that disease. It is not like put it in my basket and I will tell you exactly what to do. I engage them with me. I teach them. I think education is very, very important. Elliot Joslin, many years ago, almost 100 years ago, said that patients who know more live longer, which means that education is a big foundation of the diabetes management. So this is the first activity that I usually do, educating my patients about their disease. The second activity is that I always motivate them. No blame, no guilt. Even with minor success that they do, I congratulate them. I encourage them. And if they are not doing that much good like before, I remind them with the good days. I don't blame them. I give them some excuses and say, okay, here is a line now. Let us move for the future. So that activity and motivating people make them happy all the time and stick to their management plan, become more motivated, and do much, much better. The third activity that I usually do with all my patients is that I give them tools, and especially tools when they are out of track. Like for example, I usually tell them, you are on a highway. We put you in the right highway, because in every person's life there is a fork. Either you will go in a bumpy way and wrong way, and that wrong way will end up with complications and with hospital admission and maybe heart attack or stroke. And there is another way, which is a very clear, good, straight highway. Now, if you are on the highway, you may take a wrong exit. And if you take a wrong exit, you are not building your house in the wrong exit. You are not living the wrong exit. What you will do, you will return back and then continue on the highway. So I give them the tools from lifestyle, the dietary tool, the exercise tool, the behavior tools, the checking of their blood glucose level. Sometimes with people on continuous glucose monitor and on their arms, that give them all the information that they will need. And actually, I found that this is a very good lifestyle intervention tool, because they can immediately see what is the impact of what they eat or if they exercise on their blood sugar momentarily. So in that way, they will know what to change, what to eat, and so on. So between educating them, motivating them, and give them all the tools that they need to succeed, that's the way that I usually do in my practice.
What works best? One-to-one engagement, group activities, or perhaps a combination of both?
In reality, each one of them has its own advantage. So let me start with the group first. Group dynamics is very, very effective. And when we do our programs, we do it in a group dynamic way, because it's a multidisciplinary programs for lifestyle. So we have a dietary component, we have exercise component, we have psychological component, we have education component. So it works very well in a group. But when you are with a group, you have to be very careful, because you need the group to work like a team, like a football team or a basketball team. They are all together, and their success is by that team activity. So we encourage interaction between them, team activity, and this is very useful in the long-term program. So if you do a program for 12 weeks or 16 weeks, you better do it on weekly basis in a group format. We have been doing it for almost for 19 years up till now in that way, and it has been very successful. And I found that the team has energy, has dynamics, people get connected with each other, motivate each other, and even after they finish the program, they build a social media relationship or some kind of relationship. They can go out together, they can do activities together. And I think the team dynamics are very, very successful in the lifestyle intervention program. One-on-one is very important for people who are struggling and they are not suitable for team activity. So if they are struggling because of psychological issue or because of physical issue in relation to exercise or because of dietary restriction or habits or whatever in their lifestyle or home living or work living, those people need special attention. And one-on-one usually works with them very, very well. And sometimes we do also combination. So people can be in a program, in a group setting, and then in the follow-up, they continue on one-on-one to maintain that success that they achieved in the lifestyle intervention by the group multidisciplinary approach.
How long should supportive activities continue for?
So if we aim for intensive lifestyle intervention, at least between 3 to 6 months of intensive intervention. Intensive intervention means that they will have a multiple contact with the coaching, whether it is nutritionist or exercise physiologist or psychologist, maybe on weekly basis or bi-weekly basis. But then beyond the 3 months or 6 months, then it will be less frequent visits. In our practice, we assign a partner. We call it partner. One of the coaches in the weight management program become a partner, and we ask people to come and see that partner between 1 to 3 months. Sometimes we have a group every month or every 3 months to get people all together and discuss with them some of the lifestyle topics and in the same time motivate them to keep up and doing. But as I mentioned, the first 3 to 6 months are intensive, and then following up, it can be one-on-one and every 1 to 3 months to keep you. Beyond 1 year, less frequent could be every 6 months, and monitoring people and give them the tools. And when you educate people very, very well, they continue to do it for very, very long time in a good way. We just published data for 10 years after Y-Weight program, and people are still maintaining their weight loss. Last year in the American Diabetes Association, we presented data after 15 years, and people are still maintaining around 7% weight loss. So we have a long-term data right now. One of the best kept secret is that it's very important for people who are doing lifestyle to keep their muscle mass up. And the way they keep their muscle mass up, they eat more protein and they do more strength exercise. Strength exercise for people with diabetes is very important because the muscles are the main source of energy. So you need to maintain energy expenditure at higher level all the time. Because when people lose weight, they lose muscle mass as well. And the loss of muscle mass can reduce energy expenditure significantly down. So we encourage them to keep their muscle mass up all the time.
So the answer is to keep the patient as motivated and as informed as possible.
Yeah, you are absolutely right. And we usually teach them about SMART goal. SMART goal, to be specific, to be measurable, to be attainable, to be time oriented. So we tell them, even we educate them how to build a SMART goal. So from the start, they have a goal. They will say, I would like to be reasonable, losing 5 or 6% my body weight over 6 months, and I will use it by doing the physical activity and reducing my caloric intake and change my dietary and monitor my blood glucose level. So they know that they will do stuff over a certain period of time and the way that they will do it. And then we keep educating them about all those tools all the time. Once they are educated and motivated, I think they can continue to do it for a very long time.
So, what take home messages can we give the viewers?
The take home message is that type 2 diabetes is a lifestyle disease. People get that disease mostly because they gain weight, because they are not doing much activity, they are eating wrongly. And once they correct their lifestyle in a very good way, especially very early in the disease, they can reverse the disease, or even they can induce remission. We have a program now called the Diabetes Remission Outcome Program, or DROP program. And actually, in this program, which is a multidisciplinary approach, people stop their medication from day one if they have diabetes less than 5 years. So don't think that this is a disease that will live with you forever. If you do a very good lifestyle, especially in the very early stage, within the first 5 years of the disease, you can reverse the disease and you can maintain that success. But you have to be able to make big changes in how you will eat, what exercise that you will do, and measuring your blood glucose level, and stick with all this for a very long time. Hi, Robin. We know that you did very, very well for your weight management and for your changing your lifestyle. And I have been asking myself all the time, what is the best that motivated you to do it? And how you were able to keep that lifestyle for that long time and get the best results that you achieved?
Well, in 2013, I was diagnosed with type 2 diabetes, and I felt like my life was going to be over. So I started doing research and I found out about Jocelyn diabetes. And I called that day and I set up an appointment and I came in. And during that appointment, they told me about the Y Weight program that was being offered there. And I asked them what was it, and they explained to me in detail that it was a program geared to helping people get on track with their weight, eat the diet, and working out, and also bringing the sugar under control. And they said it was a team of doctors that worked together. Each had their own specialty, and they worked together as a team, putting together an individualized plan for each of the patients. So I joined, I thought that's what I needed, a little bit of in every area, a dietitian, a doctor, a physical therapist, physical trainer, and someone to talk over your issues with, like a psychologist. So when I heard about all of them coming together, I felt like that it would meet all my needs. So I joined the program. And from there, it taught me in all those areas, it taught me how to do things right. I wasn't working out at first, and it also taught me to work out. And diabetes run in my family. My mom had it, my dad had it, and I was just like, well, I want to help feel better and make myself look better at the same time, but I don't want to get worse. So it was the best decision I ever made, because so far today, I'm still hanging in there, coming in to see Dr. Hamdy, and whoever else I need to see, the nurses too. And they are really helping me stay on track.
So I understand that your motivation at that time that you get diagnosed, you would like to improve your lifestyle, improve your blood sugar, don't get the same problem like your parents. But now
Right.
it is almost 13 years since you started that. How you were able to maintain your motivation for
Well,
almost 13 years?
I continue to check in, as well as having a regular PCP at another hospital. Um, I kept my appointments every year at Joslin, sometimes twice a year, seeing Dr. Hamdy, and then I would rotate with seeing a nurse. And between seeing those doctors within those 13 years, it has kept me on track because there was times that I was falling off and I was get ready to give up, and they would always motivate me, and tell me the things I can do to make it better. And all I did was just keep up doing what they would tell me, and it worked. It worked.
So, Robin, I know something maybe clicked with you. You remember when we told you an example, if you are on a highway and you make a wrong exit. So
Yes.
tell us, what if you make the wrong exit? What you do?
Well, with we're human and we all do make mistakes and you kind of fall short sometimes. And what I would do when I fall short or make a mistake, the very next day, I would just get right back on track. Just try to continue doing what the nurse at Joslin told me in conjunction with Dr. Hamdy, who was telling me. And it would just put me right back on track. And I would just stick with it.
So I know that you will not build your home in the exit. You will continue returning back on the highway. But tell me, what physical activity made a change? How it made a change in your life? I know before you came to the lifestyle program, you're not doing that much physical activity, but now you are doing very, very well physical activity at your work and in your leisure time. So tell me how the physical activity made big change in your life.
Well, I started off slow because it was physical activity I was not used to. And I think that's what made the sugar go up so high. But I started off slow, and um, they Jocelyn team told me to make sure that I do cardio and that I do weights, um, restricts, weights, lifting weights and things like that. And I started off with just doing that, cardio and lifting weights. And so as the years went on, I just started increasing more cardio and more weights, more exercises that included weight and um, and just kept increasing my days. Like during the week, instead of doing it once a week, I would do it 2 times a week, then try to get it to 3 times a week, then try to get it to 4 times a week with a break period of like 3 days in between. So, and I'm still doing that to this day.
So I know you own one of the best beauty salons. So how you changed your work atmosphere to be an active? Are you doing any specific stuff at work that makes you active during the day? Or it is just a sedentary? Because a lot of people are sitting all the day long in front of a computer or so. So tell me how that interaction with your work did.
Actually, I have two jobs. My first job that I have, I transport mail for the United States Postal Service, and it's anywhere from 1,000 pounds to like 5,000 pounds of mail. We transport it in bulk, and everything that we transport and we drop off and we pick up, it's on wheels, so we have to push it. So that's like resistance. So that helped. And then my second job, I do own a beauty salon. I'm a licensed esthetician slash a skincare um, specialist. And part of that, when we were in school, they taught us on how to eat right in conjunction with Jocelyn, how to eat right and exercising, and how important it is to keep our outer appearance looking good, just as the inside. You want to look good and keep yourself healthy and eat healthy, because a lot of times what you eat and your lifestyle does affect your skin, your facial skin. People don't know it, but it does. So it all helped out. It all kind of came together at the end.
So, Robin, I know when we test your A1C is always under 7 and usually in 6, sometimes in even lower range than that. So, what are the three major things that you modified in your lifestyle that made your blood sugar always in very good range? I'm curious to know what you did.
I did diet and truthfully, it was diet, watching what I'm eating and exercising and staying very close to the doctors. My team of doctors at Jocelyn, Dr. Hamdy, the nurse. Um, Doing those things helped it, and also learning, taking, classes on proper foods and things like that also helped. So, and I'm still doing that.
How about checking your blood sugar all the time and know where you are in the morning, before meals, after meals? Do you think that this was helpful? Also, stepping on a scale. Do you do it weekly, daily basis? What you do?
At first, I was taking my keeping up, monitoring my sugar with sticking my with the finger stick. I didn't like that because I don't like needles, but I used to do it anyways because I know it was to benefit me. Recently, probably a few years back, Dr. Hamdy's you switched me over to the Libre monitor that your phone you just kind of put your phone near it and it monitors your sugar all day long. So that was really easy for me, especially with me having an active lifestyle that I have and working out and I'm over here and over there. That helped out a lot. I weigh myself once a week, the same day, once a week.
Okay.
And I
So what?
record it.
So Robin, if you go back like 13 years ago, and you advise someone who is newly diagnosed with diabetes or even pre-diabetes, what you will tell that person to do from your own experience? Because you are a role model now, and would like to see what you will advise others to do.
Even today, I tell people that find out that they are diabetic, I immediately tell them to do their research, but then I immediately start sharing some of my journey with them. I'll talk to them about Jocelyn and the Y Weight program that they had there and how great it was. And everything I was told about Y Weight, I will explain that to someone else. And I have done it over the years. I have mentioned Jocelyn, and I think a couple of people have went there that I referred. But that's what I do. I do just explain everything that was explained to me from day one in 2013. I just tell them how great the program is, and it worked for me. And then I'm like, you have the team of doctors there that touches every area that you need, and you can't go wrong. I said, just try it. Something is better than not doing anything. You don't have to give up. It's not the end of the world, having diabetes. It's almost like the start of a new life.
So, Robin, my last question for you. What you are hoping in the future for your diabetes? Do you still have that fear from diabetes as it was before, or you are feeling different now and you can cope with that disease and you can move forward?
Well, I'm going to stick with it. I'm going to continue to come to Jocelyn Diabetes to see Dr. Hamdy, and the nurse. I'm going to continue to do whatever it is you all advise me to do. I'm going to continue to work out. I do it 3 times a week. I'm going to continue with that. And I still want to bring my weight down. So I'm still working really hard. Sometimes it'll come down and it'll plateau and it'll come down. And I just want to get it down and just, get it to one standard amount and leave it there. And I'm just going to keep at it till I get it there.
Very good. Okay. Thank you, Robin. Thank you very, very much.
Thank you. Thank you.